Bonjour everyone. What a week. Kind of overwhelming now that COVID seems to be on our doorstep. It's easy to panic and forget all the information you've heard over the past few weeks and months about safety, quarantine, guidelines, symptoms, everything. I'd like to take the time to hit a few of the high points again just as a review. First, symptoms. If you have symptoms, call the nurse line at 679-3912 and press 1 to see about getting a test ordered. The list is expanded a little bit from when this all started, but here are the ones to watch for. Cough, shortness of breath, fever, chills, headache, sore throat, fatigue, congestion, muscle pain, loss of taste or smell, and in rare cases, nausea, vomiting, or diarrhea. Second, testing. If you test positive for coronavirus, the biggest thing to know is what protective steps to take by following orders from your medical provider according to how severe your symptoms are. About 80% of the cases don't have to be hospitalized. They get better at home with treatment of the symptoms, and then they just isolate themselves from others. Now, if you test negative, this doesn't mean green light go. What it does mean is you were probably not infected at the time your test was taken. It doesn't mean you won't get sick later. It's possible that you were very early on in your infection when your test was collected and you could still test positive down the road. This is also the case if you have a test done when you aren't showing any symptoms. You could be exposed later and still get sick. So negative test result does not rule out getting sick later. Keep track of any symptoms. If you feel ill, even after you may have had a negative test result, call and let us know so we can make sure you're getting what you need. Now, if you haven't been tested yet but think you've been exposed or you're having symptoms of the virus, isolate yourself, seclude yourself to a room by yourself, use caution in any common areas. Travel for screening and testing purposes only in a private vehicle if you can, and wear a mask. Don't attend any public, group, or family activities at all. If you must visit the emergency room, just call first for instructions. Wash your hands regularly and then disinfect any commonly touched areas. There's a link on mn.gov that will take you through a quick questionnaire to help you decide if you think you should get tested. Now, third, close contact. By definition, you're a close contact if you were less than 6 feet away from the infected person for longer than 15 minutes. If you pass by someone in the store or stand behind them in line at the gas station for a few minutes, this is not close contact. I'm not even a close contact if I'm the coworker of someone who is around someone who is positive. So let's say this a different way. Jack and I are friends. We had lunch together, spent an hour sitting at a booth having cheeseburgers and visiting. Jack tested positive for COVID the very next day. Jack has to isolate. I'm a close contact. So I have to quarantine and possibly be tested. Now, I live with my mom, Betty. Jack hasn't been over to my house while Betty's there for about 2 weeks. So Betty isn't a close contact, even though she lives with me. I haven't tested positive yet. Now let's fast forward a few days. Shoot, I test positive for COVID. Now Betty is a close contact, so she needs to quarantine and possibly be tested. So this brings me to the fourth point, quarantine and isolation. The infected person, the person that tested positive, isolates. This is what Jack had to do in the example. So it's used to separate people knowingly infected with the virus from people who are not infected. They may or may not have symptoms, it doesn't matter. If you're in isolation, stay home and don't have any visitors until it's safe to be around others, and the contact tracing team will give you this date. Stay in a sick room or area that just you will use. If you need to leave the room, wear a mask. Have your own water and eating utensils, and use a separate bathroom if you can, or disinfect a shared bathroom after each use. Close contacts with the infected patient quarantine. So these are the people that came into direct contact with the person that tested positive. This is what I had to do in the example I gave. Quarantine is used to keep someone who might have been exposed to COVID away from others. So this helps prevent the spread of the virus that can happen before a person knows that they're sick, or if they have the virus without feeling symptoms. So if you're in quarantine, stay home and separate yourself from others, monitor yourself for symptoms, if any, and then follow the directions from the medical provider and contact tracers. If you then become symptomatic, let the contact tracing team know, and they'll let you know if you need to be tested. If you're positive, contact tracing would continue for you. Now this is where contact tracing works and quarantine works. This is how we stop that snowball effect. If you've been quarantined, for at least 2 days before you show symptoms, the number of people exposed by your illness should be very low. Now, what about getting together with friends? I wouldn't recommend it. Most of the spread we're seeing right now is from this very thing. You're comfortable around those people that you know, nobody else is wearing a mask, so maybe you feel weird about wearing one, and all it takes is one positive person, usually somebody without any symptoms, to potentially infect everybody there. Then they go home, they unintentionally infect the people in their home because we aren't wearing masks at home, right? Then everybody from home goes to work, Bemidji, a friend's house, and then they start to infect those people around them, all without knowing until you do know, and then it's too late. So last, I want to talk about mask use. Simply put, wear one if you're around other people. Bemidji, Red Lake, the governor of Minnesota, they've all mandated mask use, so that's that. The biggest benefit, it keeps you from spreading around the virus in case you're sick and don't know it. It's a very real possibility right now with the numbers in our state. So stay calm, stay safe, and if you're concerned, control what you have control over. Who you're around, where you go, and what you're doing to protect yourself. Miigwech.